2023. And this is by Lamacca et al. From Italy, and he has published on predicting the total number of retrieved oocytes following double ovarian stimulation or Duostim. In this particular study, and they looked at the AMH as a predictive marker of success in Duostim. And in this particular study, they excluded women with polycystic ovary syndrome or those having diminished ovarian reserve by an FSH of beyond 15 were excluded, and the women who have taken previous combined oral contraceptive pills were also excluded from this particular study. They gave 300 IU of gonal stimulation in the follicular phase and gave GnRH agonist trigger, did an OPU, and 5 days later they started with the second stimulation. Was started and the same protocol was used even in the second stimulation in this particular group. And look at the results of the first stimulation and the second stimulation, which are there. Of the number of COCs obtained were 4 and 6, a little more in the second stimulation. The maturation, the metaphase 2 oocytes, the maturation rate was almost the same. The fertilization rate has been okay, and blastocysts per patient were almost the same. So they obtained quite a good result. But what they did is they stratified the results with the AMH levels. And this particular table explains that. Wherein obviously the AMH beyond 2, there were 25 numbers, and number of oocytes, median number of oocytes obtained were about 15, 13 to 18 was the range, and number of metaphase 2 oocytes were about 13 out of 15. So, and look at the AMH stratification, even at AMH less than 0.5, the number of oocytes obtained were between 2 to 9, and median 7 oocytes were obtained, and about 5 metaphase 2 were there. So they said that the AMH level significantly correlated with the total number of oocytes obtained, and if you have followed an AMH cutoff of 1.1, that predicted a suboptimal response that you will be getting less than 10 oocytes, and each 0.25 nanogram in AMH increase is associated with obtaining 1 extra oocyte. And earlier studies, if we compare those done by Varelli et al. In 2020, there were about 91 patients of Duostim. The follicular oocytes were about 237, while the luteal oocytes were 309, with number of blastocysts of 70 and 107 respectively. So the luteal phase stimulation is definitely associated with a better blast, more number of oocytes, and blastulation rates are better. And I think something similar has been reported in earlier papers published by Kuang et al. And Carillo in 2023. So the driver of getting extra oocytes in the luteal phase could be a prolonged gonadotrophin stimulation. So these ovaries receiving a nice stimulation in the follicular phase, and those gonadotrophins keep on acting, and that intercycle FSH is kept quite high, and that will act on the follicles. So few more oocytes will be ready to grow further and get us extra oocytes. So in a duostem, that could be one of the drivers, that having a high FSH level of the first follicular phase, getting a better oocyte number in the luteal phase. A point to ponder in your queries and questions, and also